Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Because we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Okay, we got to move along today, Brad. We got a lot to cover.
You bet.
Pinched nerve, spinal decompression at home. We're going to show you how to stop neck, shoulder, and arm pain when it's coming from your neck.
Right.
And we're going to show you by doing basically traction.
Right. Which is, decompression, spinal decompression, traction, basically the same thing. We've got some good options you can do at home, but these are things you really need to know what you're doing. There's a simple, but we have some key things, and if there's any question,
look out for them.
Yep, go to a therapist, and then you know what they're going to talk to you about.
Right. And by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you don't know this already, we're having a contest over at Bob and Brad at Facebook. We're giving away a mattress.
A nice mattress.
Yeah, a Sleep Ovation mattress, beautiful mattress. All you have to do is there's a post. If you go over there, it's the first post you'll see.
Right.
You just have to like it and make a comment on it, and you're in the contest.
There you go.
So
you don't have to write a book, just a couple words.
Yeah, just say you like Bob and
Brad,
yeah.
Anyways,
right.
Bob, let's go on.
So what are we doing?
Well, spinal decompression. If you got neck pain, typically in the shoulder, on the back side of the shoulder is where it presents itself, and then down the arm, some numbness, tingling that may go to
Burning.
the elbow. Yep, all the way up into the fingers. There's a good chance it's from a pinched nerve almost in your lower neck.
Right.
Okay. Now, a simple way to test to see if some decompression or traction is going to work is, why don't you have a seat, Bob?
Sure.
There you go.
So I'm getting pain.
Yep, so scoot your bottom back in the chair, nice. I always tell this to my patients, good posture. And I'm gonna take my hands like this. Now, everything we do throughout this whole video with the neck is gentle. We're not doing anything aggressive whatsoever. So Bob has pain, tingling going down his arm, and I'll go like this, and I'll go gently, and I'll pull up and say, Bob, do you feel any changes when I do that?
I can't talk because you were pulling my... Yeah, it felt better. I felt a little relief.
And I'm not doing very much, right, Bob?
No, you're not.
And that's all you're doing. You're not going to get your whole body into lifting and try and lift the person off the chair. It's a very gentle distraction or traction, okay? And then also I'll go from the top down, and I'm not going to put my weight into it, just with one hand, and I'm going to gently push down.
Ow, 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 ow.
And if that makes it worse, then, you know, there's a very positive sign something's going on in the neck. Now, if this makes it worse, push it down makes it worse, but this doesn't change it at all, doesn't make it better, I probably would not do any more traction. You know, maybe I would, as a therapist, investigate it more, but at home, I wouldn't even consider it. It's got to be very clear, a little bit of pressure. Oh, it feels good right away. Then we're going to go to step 2. So in the seated position, a little bit of traction here makes everything feel better. Then you can go to the over-the-door traction unit. The nice thing about this is it's at home and it's really inexpensive.
Very inexpensive.
Yep.
What are they, less than 20 or something like that?
Right, last time I looked, it was around $20, sometimes less, sometimes more, depending on where you buy it from online.
A little difficult to set up.
Yeah, it's not bad, but you know, we've got it set up here on the wall, but typically you go over a door.
Right, it's set up to go over the top of the door.
Right, and that works very convenient. That part's easy. You have to get the rope, and then there's a weight for the traction. And this is kind of nice. You put water in it, and it tells you how many pounds line. Like right now, I've got 6 pounds of water in there.
Gotcha.
Typically, I'll start at about 2, 4, 5, or 6 pounds with a person. Now, this you can do by yourself.
This is where it gets complicated. Yeah.
But it is a little easier with 2 people.
Yeah.
Before I did it, and after you do it for a while, I've had patients that use this.
Yeah, once it gets set up, I mean,
Bob?
for one thing, it has to, you know, the Velcro has to be set so for your head, you know, for your chin and jaw. And, you know, he already did that. So.
There. And it's comfortable. It really is comfortable. I've got enough pressure on there. Now you're going to add weight.
So now we have this set up so it's pretty much just bringing the head straight up.
Right.
Because some people kind of do a little forward flexion or a little extension.
Right.
I think that the safest thing is just to go ahead and straight up.
Right. I mean, you could turn the chair around facing the door.
Right.
And see which way gives the better results. But once again, you're only going to do this is when the pressure is on. things feel clearly better. It's a good feeling. I start my patients out at 5 minutes as long as it feels good. Then I'll take it off and see how it feels after the weight is off. So we'll simply just take it off, let the weight go down. And if it still feels good, I say go home, come back tomorrow. And if it feels good for the rest of the day, then I'll go up to 10 minutes and build up to 15 minutes. But each time I make sure it feels good while you're doing it and afterwards, not just for a few minutes, but for the rest of the day.
Or even if it gives you relief for an hour, right?
Right,
I mean,
right.
as long as not, if it feels worse after, then it's obviously a red flag, and we're not going to go.
Usually doesn't happen, but you have to make sure.
Do you want to show Brad how you can try it with a towel?
Sure.
I mean,
yeah, you can simply take a towel, roll it up as such. I got some tape on there, go around the back of the head, and we're going to pull on that occiput there, and we're going to go straight up like this. And once again, how does that look? Huh? That's kind of scary.
the problem is generally if you're having pain down the arm, so that's why sometimes you have to grab it with one hand, like that, or have someone pull on it for you.
Right. This is one of those things that it's not very practical because how long can you hold it?
Right.
Your arms get sore, whatever.
And you have a sore arm already.
Right.
I mean, people do it laying down too, and they pull, but
sure, that's a little easier. But if you don't have this, another option is you can do this at home is use the Saunders device.
Yeah, now I wouldn't spend money on this unless you were getting some relief on an inexpensive one, because this is $300.
Right.
So it's expensive, but it works very well.
Yeah, it is very convenient. It works much better than this. You can lay down comfortably. Why don't you lay down once, Bob?
You can put it in place, and I can.
No, lay down, Bob. He's not listening to me again. No, what?
I practice at home, not listening to my wife.
Okay, you can go right to that. What I'll do is I'll take my hands like this. I go right behind the ears on the occiput bones there. That's those bones right there. And I'll just gently pull out. And if that gives relief, and Bob would say, Bob, does that feel good?
Yeah, that's starting to feel better.
Okay, and it feel better in the arm?
Yes.
Okay. Now, actually, I'll hold this for up to a minute, and my fingers will get pretty tired. And if it feels good for a minute, I'm saying, let's get the Saunders Traction out. So, this device right here, you might have to scooch down a little bit, Bob. It takes up a little bit of space. Now this adjusts. I'm not going to go through the adjustments, but there's some thumb screws here, so you can adjust.
This would be a whole different animal to, demonstrate. We're just going to kind of show you today what it can do.
Right. We actually do have another video that goes through the complete use of this, and you can, if you go Bob and Brad Saunders cervical traction, you can get that up. So it's got a nice little pneumatic pump in here. You want to pump it up, Bob? And
sure.
Liz, can you zoom in here? And we're going to watch this separate here, which is going to offer that traction or the decompression on his neck.
So on the pump here, it says hold, pump, and release. So I'm putting it to pump.
Yep.
And then I'm going to go ahead and start pumping. So it actually, it gives me both directions. When I pull it and when I push it, it's pumping.
Sure. So he's getting some movement there. This is nice, and I have my patients do it to themselves so they feel comfortable with how much pressure. Typically, I start between 10 and 15 pounds, and there's a gauge on there. That oftentimes is enough to get some response, positive response.
I now put it on hold,
okay,
so I can hold the position that I'm in.
And then you just relax. I do the same thing. I go for 5 minutes as long as it continually feels comfortable. Sometimes these pads get a little uncomfortable on that bone there, but you have to just use your judgment. As long as the neck, shoulder, and arm, particularly if the arm is the symptoms go away there, that's a really good sign. Go for 5 minutes, see how it lasts afterwards. If it still feels good for an hour or two or longer afterwards, then I'll go up to 10 minutes and maybe the next day up to 15. Typically not more than 15 minutes.
So on the gauge, I can see right here, if you read it, it's on 11 pounds right now. So that may be more than you would recommend to start off with, huh?
Well, it depends on this. A bigger
it feels good to me.
Yeah, if it feels good and the arm feels good, everything feels good, I'll hold it there. I've had people go up to 20 pounds, but usually not more than that. Although in the instructions they say more than that. I like to be conservative It's got to feel good, good, good. Everything should be good, positive responses. And I've had people buy these and use them at home long term.
Yeah, and there's an ejection button on here. Push this and it ejects me up. No, I'm joking. So,
okay.
all right, I'm gonna go ahead and release it.
There you go.
So I turn it to that, and now it's releasing.
Yep, it just automatically goes down nice and gently. Take the head strap off. You don't have to tighten that down over your forehead very much at all. And they got a nice kit for it.
So I have a mark on my forehead now?
Yeah, you got a mark. We got a few extra wrinkles, Bob. No, it doesn't do that at all. So there you go. You got cervical decompression, traction, whatever you may want to call it. Some options that you can do at home. Once again, Bob, this is just one step forward to fixing everything.
Yeah, we can just about fix it. We can fix just about anything except for
a broken heart.
But we're working on it.
There you go. I don't know if there could be heart decompression.
Yeah, there's compression for the heart when somebody
there
has
you
a
go.
heart attack, so.
Yeah, that could probably help that broken heart.
Well, we're really thinking.
There you go. We'll do that in the next chapter.